Well, to another sector now, we're talking health now. Welfare remains a burning issue as resident doctors begin a warning strike across the country. As the three-day action takes effect, patients are already feeling that pinch, with many at the Lagos University Teaching Hospital LUTH reported to be stranded. The action did not have much impact at the Federal Medical Center in Abeokuta, the Ogun State capital, even though the resident doctors there have already withdrawn their services. However, the strike is in full swing in Abuja, Nigeria's Federal Capital Territory. Our health correspondent, Yomi Otaibe, reports.
It has moved from a statement to action. Public hospitals in the country are opened, but not at full capacity. Another time for patients to suffer for what they were never involved in. The National Association of Resident Doctors, LUTH, claims the government has breached the agreement it had with it. The association wants a uniform template on appointment of resident doctors. Also, that the federal government, through the National Salaries, Income and Wages Commission, should, in line with earlier agreement, issue out the circular on allowances. And in the Federal Medical Center, Owerri, LUTH wants the government to pay the salaries of its members at the center, as agreed in October 2013. On a normal rank-of-free work day, the Federal Medical Center, Owerri, has about 1,000 doctors to attend to these large number of patients. Several hours after the declaration of a 3-day warning strike by the resident doctors, patients are at the mercy of their helpers. Only few consultants are available to render that needed medical help. In Kaduna, the doctors' strike is effective. Only minor cases and emergencies are handled by consultants who are not members of the Association of Resident Doctors. New patients are turned back. This is the same story in Abia and Cross River states. However, the strike order is far from having the much-expected impact at the Federal Medical Center, Idi Aba, in Ogun State, southwest Nigeria. Here, nurses and consultants are going on with their professional duties to patients. I'm here at the Lagos University Teaching Hospital, Idi Aba, where the management of the hospital will not allow us to take shots of what's going on inside the clinics or the wards. But my interaction with some of the people seeking medical services here revealed that the resident doctors are actually on strike.
They said they're on strike and have a patient here who is swollen. He has a swollen belly and this thing.
As an affiliate of LUTH, we've complied with the instruction to embark on a 3-day warning strike.
I think we may not be able to take very serious cases, maybe emergencies right now, but for every person who is already on the ward and cannot go home, we definitely will look after.
The next 2 days will be challenging for Nigerians who will be seeking medical services in public hospitals across the nation. All eyes will be on the Federal Ministry of Health and the resident doctors to nip this warning strike in the bud so that it does not snowball into a full-blown industrial action. Yomi Otaibe reporting for Channels Television News.